Hello YouTube, it's your favorite sonographer, Babs. Today I'm going to talk about my personal experience getting an ultrasound. I'm not going to go into too much of the details because I am not a big enough YouTube creator to get away with it. So it's December 22nd. I am 7 weeks postpartum. I don't know when I'm going to upload this video because my laptop is in the fritz. That's one of the reasons why I haven't been able to upload in months. And another reason because I've just been lazy. These things could have been resolved months and months ago, but I have a video explaining more.
Nope.
When I was 19 weeks pregnant or around that time, I had an anatomy scan at my job with my coworkers. So a colleague scanned me. And at the time, my husband and I didn't know the gender, so I didn't look at the screen. But even if I had looked at the screen, there was nothing that would have worried me. And even after finding out the findings, I still wasn't worried. So to begin, at the time I was 37, so I was automatically categorized as advanced maternal age. So the findings were that the baby had a small nose, an echogenic focus of the heart, which is just a bright spot in the heart, and a lemon-shaped head or skull, meaning that there were two indentations right in front of the skull on either side. And when you look at that on ultrasound, it looks like a lemon. All of those findings by themselves, and maybe even on a younger person, would have been no big deal. But because of my age and because of those three findings together, they wanted to do more investigation. The problem with that is once they suggest one test, they want another and then another and then another. And they can't just leave it at that. And I know it's important. It's for peace of mind. It's in case they miss something. And it's also because one test doesn't show the whole picture. And they want to cover their ass. But on the flip side, as a patient, I was annoyed because, and not only because as a patient, but because as a sonographer, I believed that everything was normal. I believed my baby was okay. The first two tests that they recommended were a fetal echo, which is just an ultrasound of the heart, and a level 2 anatomy scan. Now, the level 2 anatomy scan is the same as a regular anatomy scan, except it's more detailed and it's looking more into a specific area of the baby or a specific body part. Now, I did the anatomy scan, the level 2 anatomy, and they looked at the brain, they looked at the spine, it looked normal. And I did the fetal echo, which is just of the heart, and that was perfectly normal as well. But because everything was normal and they couldn't find why my baby's head was shaped like a lemon, because now they've looked at the nose and that was not a big deal. Two reasons why. One, because it was at the small end of normal. Yeah. It was at the small end of normal. And because, don't you know I'm black? Like, hello, I might be, Dominican, but I am African American descent, and African Americans typically have either no nasal bone or very short nasal bone. So that wasn't a big deal. Also, the fetal echo, no, not the fetal echo, the echogenic focus, the bright spots in the heart, used to be an indication of Down syndrome or a possible, warning or sign that the baby might have Down syndrome. But so many babies have it, like we don't even look at it. I mean, we look at it, we might mention it, but it's not really a big deal. So the main concern now was really the lemon sign. Usually, if it is caused by a problem, the brain would be abnormal and the spine might be abnormal, but everything was fine. But because everything was fine, they wanted even more tests. Now, after that, they wanted me to do an amniocentesis, which is a procedure where they take a huge needle and they stick it into your belly, into the uterus where the baby is, and suck out the amniotic fluid, and they send it to a lab and they test for all the other things. Now, that test will tell you indicatively, is that like the word? Anyway, if the baby has an abnormality. And the other test that they wanted me to do was an MRI. Now, at this point, yeah, I could do ultrasounds, it's no big deal, but now they're suggesting like bigger things, more high risk things, because an amnio, even though it's safe, it still comes with potential problems. And if I was able to upload the video where I was sent to the hospital for my fibroid, who knows, maybe the amnio kind of triggered the uterus, not the uterus, but maybe it triggered the fibroid to get irritated, because the uterus is a muscle. And even though the needle was far from the fibroid, maybe the fact that a needle went poking where it doesn't belong aggravated the fibroid in some way, or aggravated the muscles, which then aggravated the fibroid. I don't know. And there are risk of infections and a small risk of fetal demise or going into preterm labor, you know, things like that. Very small risk. Amnios are pretty safe, but there are still risks. And then there's the MRI. I think MRIs are pretty safe. The only risk is you might have an anxiety attack because it's very loud in there and you're in an enclosed tube. You're in a tube. So it can be pretty scary. The MRI and the amniocentesis both came back normal, which I believed it would be. During the level 2 anatomy, my colleagues looked up the ultrasound images of my first baby, because I also had the ultrasound there and I also had her at my job. And come to find out, she also had the same thing. She had the indentation in the skull. She had the lemon sign. So obviously they didn't think that it was such a big deal, or it wasn't so significant that they didn't really notice. And plus everything else was normal. So I guess I just make babies with lemon-shaped heads. I later had a 3rd trimester ultrasound to take a look at the head, and it came back perfectly normal. It looked normal. It was a good size. It was a good shape. And take a look. Look. Come on, baby. Come on. Take a look at the camera. Take a look at the camera. His head is pretty damn perfect, don't you think? Wouldn't you agree? Mwah. Cutie. Look, say hello. Say hello. Now, there are some patients who are hard-headed or delusional, and there are very clear problems, but they don't want to listen. I wouldn't suggest not listening to your doctor, but sometimes it's just best for you to either get a second opinion or to just follow what you believe. At the end of the day, I did it just for peace of mind. I knew that everything was okay, and I just wanted the test to just prove it. So that was my experience. I don't know how long this video would be, probably very short. When will it be uploaded? No clue. But I gotta go because he is hungry. So I'll see you guys another time. Ciao.